So I wanted to just go through some of the common skincare myths as it relates to sun exposure and sunscreen. Some of these are probably even more complex and complicated beyond the scope of this discussion, but I'm going to do the best I can. So the first myth is that wearing sunscreen can cause vitamin D deficiency. And this is very tricky. Patients ask all the time, especially now that the labs have changed their standards for what defines vitamin D deficiency. More and more patients are coming in and saying they just found out they're vitamin D deficient. Does that mean they need more sun exposure? So I think it's important to recognize the fact here that few dermatologists believe, and no studies have shown, that daily sunscreen use causes vitamin D deficiency. And along with this argument, first of all, so there are two ways to get vitamin D. One is through a healthy diet that may include a vitamin D supplement, and that's the option that I tend to favor. The other way that we do make vitamin D is through the skin, because we do have UVB receptors in our skin that can actually produce vitamin D. However, it's important to realize that these receptors get saturated after even just 5 to 10 minutes of unprotected sun exposure. So therefore, even if you're in the sun, completely sun exposed, you're going to saturate those receptors after just a few minutes, which means that additional sun exposure is not going to make any significant difference. So what I tell my patients, it's a much healthier way to get vitamin D through your diet, to eat vitamin D fortified foods like cereals and milks, and salmon's another great source of vitamin D. And if appropriate, you should talk to your internist about potentially taking a supplement, because we know that unprotected sun exposure is definitely dangerous, and it has never been proven that daily sunscreen use causes vitamin D deficiency. Okay, number two is a myth. If it's cold or cloudy outside, you don't need sunscreen. This is definitely not true, and I hear this from my patients every day if they come in with a sunburn, and I say, why weren't you wearing SPF? And they say, well, it was cloudy outside or it was raining. Okay, so number one, of course, the weather can always change, so even the cloudiest or most rainy day can turn very sunny, but even more importantly, up to 40% of the sun's ultraviolet rays still reach the earth on a completely cloudy day. And this incidental exposure often leads to the most serious sunburns. And I'm sure it's all happened to all of us, or someone that we know where someone gets sunburned even on a cloudy day. So again, the rays penetrate through, especially those longer wavelength UVA rays we talked about. Those can penetrate right through clouds and even through office windows and car windows. So this is yet another reason that we should try to get people in the habit of applying a broad spectrum sunscreen every single day. Third myth, if you tan before going on vacation, it will protect you from getting burned. And I think this is really important because there really is no such thing as a safe or a healthy tan. What a tan is it's a sign of DNA damage. So basically, when the skin gets a tan, that represents the body mounting a defense response. It's sort of a stress response in our skin to try to prevent us from getting further damaged, and it's representing the DNA damage is already occurring. So there's really no such thing as a safe tan. I want to just take a minute here to talk about sunless tanning, because for patients that still like to look tan, I do think that the sunless lotions and creams and even spray tans are safer than getting a tan from the sun or from, God forbid, an indoor tanning salon, which we'll talk about. But I think it's important to know that these sunless tans that people get from a bottle, although they are safe, they don't provide any sort of base tan, so you can certainly sunburn even though you already have a sunless tan. So importantly, I always tell my patients it's okay to use sunless tanners. In fact, I recommend it if you feel like you must look tan, but make sure that you still apply your sunscreen on top of that, because you can definitely burn despite that. And I just do want to say a quick word about indoor tanning, which is unfortunately still incredibly popular, and I do think people often do it at the start of summer or before going on vacation. Even one indoor tanning session increases your chance for developing melanoma by 20%, and exposure to indoor tanning before age 35 increases one's chance of melanoma by 75%. So we know this is actually the most dangerous form of tanning is indoor tanning salons, and there's a lot of legislation being worked on to try to regulate this better and certainly to prevent our minors and our youth from exposure. But certainly, again, there's no such thing as a safe or healthy tan. The next myth is, this is a very important one. There's a common myth that most of your exposure comes as a child, so it's too late to do anything now. And as a dermatologist, I hear this in practice every day where patients say to me, oh, it's too late, the damage is already done, why bother? This is very important. A recent study showed that we get less than 25% of our lifetime total sun exposure by adulthood, so by age 18. So this really shows that skin damage and aging of the skin and sun exposure, it's really a cumulative process, and it's really never too late to protect yourselves. There have been some recent really groundbreaking studies that followed, and one or two of these studies was out of Australia, which is like a skin cancer capital of the world, but they followed adults even in their 50s and 60s who started wearing daily sunscreen. Over the course of 20 years, they followed them, and those patients had less skin cancers, less aging of the skin, less brown spots. So it's really never too late to make a difference, and we should all start wearing daily broad spectrum sunscreen, whether or not we were careful when we were younger.